So I've had a couple of back operations in the past.
Yeah.
Today I'm experiencing a lot of similar sensations that I had with my first back operation.
Yeah.
Where I thought after a year of dealing with extreme pain and only given codeine to deal with it, and sleeping about an hour a night for a year.
Yeah.
Let me see if I can get my thoughts straight here. I got to a point where I had a sensation that I couldn't feel the lower half of my body.
Yeah.
Tonight, I'm having a sensation that I can't feel the left side of my body. Not so bad as before. But
where do you see the left side from where to where?
From my, not from my head, shoulder, essentially down to my,
right.
My knee felt like it was going to explode earlier today.
Yeah.
Having a lot of extreme pain in my shoulder, my heart area. I don't think I have a cardiac problem. I asked to see a neurologist, and the resident doctor told me that I don't qualify to see a neurologist because I'm not incontinent. But both of the neurologists that I've had in the past that did operations on me.
You mean neurosurgeons? Yeah, yeah.
Neurosurgeons. Sorry.
Yeah.
Not a doctor.
Yeah.
They never ever mentioned that. They never asked at VGH or I guess VGH, if I was incontinent.
Yeah.
And they both times presumed that I wouldn't be incontinent because I was on hydromorphone, which causes constipation, which I'm experiencing right now. So I did ask to see a neurosurgeon and was refused by the resident doctor because I am not incontinent. So do you think that's a normal assessment?
I have to sort of talk to her. First of all, we don't have neurosurgeons here, but I mean...
You don't have on-call neurosurgeons in St. Paul's Hospital?
No. There's no
Really?
neurosurgery here. The program left in 1998, I think it was.
Oh, okay.
But why did I see a neurologist?
Yeah, you might have seen a neurologist here. I don't know for sure. I'd have to look at your chart.
Yeah, you did a CT scan. Dr. Wong said you did a CT scan on my neck.
Yeah, Milton Wong, sure.
But both Richard Chan, who did my operation in 2006, and
he works at Royal Columbian.
Dr. Fairholm, who did my operation in 2000, told me that CT scans, X-rays are essentially useless when it comes to disc issues.
Yeah.
Every doctor I've seen since August 5th, I've told I've had a history of disc issues.
Yeah.
I've also told them that my mother has a degenerative disc disorder. I'm not sure what it's called, but I know she has that. In some cases, doctors told me that my problems were all in my head.
Yeah.
The neurologist, Dr. Wong, and I saw within 3 minutes of assessing me, told me that I have a problem with my C7 disc, and asked the resident to do a CT scan of my C7 disc.
When did you see Dr. Wong there?
That was on the 21st. I got my scan on Monday.
Yeah, so you've already had a scan then.
I've had a scan. It was inconclusive because, well, I guess the first two neurosurgeons, Richard Chan at the time being considered the best one in British Columbia, and Dr. Fairholm being the top one at VGH at the time, said that CT scans essentially are useless when it comes to disc issues. So, would it be possible to get an MRI and see a neurologist or a neurosurgeon at some point, somewhere, some hospital?
Well, who's your family doctor?
He's on vacation until September 9th.
Yeah, I mean, you won't get an MRI tonight, like that's for sure.
Why would that be?
Just because we won't do them in the middle of the night. Like they don't do them in the middle of the night unless, it's sort of life and death type of thing. And it sounds like a lot of the issues are long-standing for you.
Well, no, I've never had an issue where I can't feel the left half of my body or having such extreme pain in the left half of my body.
Yeah.
I really don't want to have to be put into a life and death situation in order to have my body go.
Yeah. No, I totally get it, but you won't get an MRI during the middle of the night. Like it just won't happen there.
It's too expensive.
No, it's not a matter of cost. It's a matter of resourcing, and they won't. There's certain conditions they'll come in for.
And what are the conditions that need to be met?
Yeah, well,
I don't mean to sound aggressive because I've talked like this to people In my last emergency discharge, I talked to a social worker. I was speaking as I'm speaking now.
Yeah.
And I saw the actual chart, which said that I was being aggressive and violent. I hope I don't.
Yeah, yeah.
Not giving you the impression of being aggressive and violent.
No.
Asking intelligent questions apparently is being aggressive and violent. And
Right.
But I'm just trying to be clear.
Yeah.
I haven't had a lot of sleep. I think I'm being pretty clear though. What do you think?
Yeah, I think you're being pretty clear. I mean, it's not the patients that get to choose. It's sort of the clinical condition, and we sort of put it together and decide whether someone needs to have an MRI urgently or not. And I don't know if your situation exactly qualifies that or yes or no there. But tell me exactly, the reason you came in tonight was for what?
Extreme pain on the left side of my body. My knee felt like it was going to explode.
Yeah. And so it sounds like you have
had
knee
heart pain.
Yeah, you had a knee effusion there, and that's been aspirated. So I think that's sort of taken care of. That sounds like it's a local issue. In other words, independent of your spine.
So a knee. What is it?
You had an effusion, which is fluid in the joint.
A5F5
Yeah, exactly. Yeah, effusion. Yeah, and there's many reasons for it, though. So Caitlin sent that off to the lab, and we'll find out what it is.
Thanks.
Yeah. Now, so you felt your leg's going to explode. Now, where is your numbness and tingling there?
The neurologist.
No, not you, the neurologist. Where is yours? Like, where do you feel that?
Well, can I show you on your back?
Yeah, sure.
So it's right. If you just turn a little.
Yeah, sure. Go ahead.
So it's going to be right. Let me see your shoulder blades. It's right around there.
Yeah.
And so when I pointed that out to the neurologist, he said to the resident, wasn't talking to me, that was that point would be an indication that's a problem with the C7. Then he tilted my head in a certain direction, and the other doctors had tried tilting my head and whatnot, but the direction that he tilted, he said that hurt, and he could tell that it hurt right away. And then he did a test where I had my hands put up in front of me, and he's a very tiny little man, and he pushed my hands, and this arm went in.
Right.
And I realized after that with my daughter on a Saturday afternoon, that if I lay down in the grass, I was just watching her play with the dog, and I actually couldn't get myself off the ground using this hand.
Right.
This
was when?
This was Saturday before last. And
right.
I am a right-handed person, but I've always been fairly ambidextrous, I just could not even control my body. Steer it into a direction. I essentially was a clown rolling around on the ground until I could get my right hand into the position.
Yeah, and do you feel that's recovered, or?
No, not at all. It's actually deteriorating. I'm a guitar player. I've noticed that my manner dexterity is decreasing, not rapidly, but alarmingly. I've kind of reduced myself to playing the piano lately, so that I can hit bass notes, use it like a stump more than a hand that actually has. But I'm not. I wouldn't claim to be a Mozart, but my hand usually does work fairly efficiently.
Yeah.
And it hasn't been definitely since August 5th.
Yeah. So we're now like September 5th. So what's happened in the interim?
I haven't been sleeping very much. 2 nights ago, I took. My GP saw me. I explained my situation. I showed them the charts that I have from the hospitals.
Yeah.
Some of the explanations. One of them was it's all in my head.
Yeah.
So he prescribed me enough hydromorphone because he was going away on vacation.
Yeah, sure.
And I told him that my experience with hydromorphone, that I'm not an addict. I don't use it when I don't need it. I explained to him a situation where that I actually threw out a bunch of it after an acupuncture treatment. I don't like drugs. 2 nights ago, I really need to sleep. I took 2 Valium, 2 hydromorphone, went to sleep. I woke up 2 hours later. Stayed awake for about 2 hours, and then took 2 Valium, 2 hydromorphone, in an attempt to get sleep because I was literally exhausted, and slept for 2 hours. The next night, I didn't want to take any Valium, and I didn't sleep for 1 second. I took 2 hydromorphone at the beginning of the night, maybe 2 in the middle of the night or something like that. The only thing that I did different tonight, I took 2 Valium at the beginning of the night, At 10:30, I took 2 hydromorphone, and one of the nurses suggested warm milk, so I only had chocolate milk. That's the only milk I could find. That was the only difference, but I did. I mean, as soon as I lay down, my knee started feeling like skyrocketing pain, pain in the chest, shooting electrical lightning-like charges of pain right here.
Sure.
The neurologist also said that that point is like with my previous back operation. I complained that I had pain, or right here, for probably 3 years, and then when I saw my first actual neurosurgeon or neurologist, I'm not sure. They said that that point is an indication that I had a problem with L4, L5. And about probably 17 emergency doctors didn't realize that up until that point. So.
Right. And tell me who the main neurologist is that you're saying.
I've seen Dr. Wong once. I asked him if I was going to see him again. He said, "This is a one-shot deal." It was an outpatient thing, I believe. I got recommended, or I got a referral from one of the doctors here, one of the female doctors, and probably the most compassionate.